Okay, so in this video, I'll be sharing tricks to remember the side effects of cytotoxic drugs. So, first of all, whenever the question comes on the side effects of cytotoxic drugs, we need to know some common side effects. And also, let me tell you, I've taken this trick from first aid. It is not my self-made trick, but this trick I really wanted to share, so I'm making this video. So the common side effects. So the common side effects of cytotoxic drugs are same. First, the most important side effect is bone marrow suppression. Due to bone marrow suppression, there is anemia, thrombocytopenia, anemia, and after that, so this is the first most important common which you can write for all the cytotoxic drugs. The second common one is alopecia, that is loss of hair. Third you can write is GI symptoms like vomiting, diarrhea. Okay, so these are common. Then fourth very important is hyperuricemia. Why is there hyperuricemia? There is hyperuricemia because these cancer is basically uncontrolled proliferation of the cells. So these cytotoxic drugs will lead to degradation of DNA, and DNA will lead to purine and pyrimidine metabolism. This purine and pyrimidine metabolism breakdown will lead to formation of uric acid and will lead to hyperuricemia. So these are the common. You can write these symptoms anywhere. Bone marrow suppression, which leads to anemia, thrombocytopenia, alopecia, GI symptoms including vomiting, diarrhea, hyperuricemia, DNA decreases, purine pyrimidine breakdown increases, leads to formation of uric acid, which causes hyperuricemia. Now let's see the specific symptoms or specific side effects of cytotoxic drugs, which are specific to a particular drug. Now to remember it, this is a trick from first aid. Draw a stick figure like man, which we used to draw in childhood. Like this is the stomach, these are the hands, these are the legs, a smile, ear. Draw lungs, a pair of lungs, a heart in the mediastinum, write a T in the heart, kidneys, and a bladder. So now see this figure and you will see that there is a letter V over here and over here, basically in the extremities, the hands and the legs. So we can remember vincristine, it is a cytotoxic drug which causes, since it is in the peripheries, it causes peripheral neuropathy. The specific side effect is peripheral neuropathy. Now let's see D. So you can see C first of all. C. So C, the ears are in the shape of C. So which cytotoxic drug starts from C? Cisplatin and carboplatin. And both these cytotoxic drugs cause ototoxicity. You can see it, the ears, ototoxicity, and see this, the kidneys are also C-shaped, so they also cause nephrotoxicity. And now after this, also remember that cisplatin, the smile, it also looks like a partial C. So cisplatin is one of the most emetogenic drugs. How do we vomit? We vomit from our mouth. So it is one of the most emetogenic drugs. Now See this, the lungs, they look like bee. I have purposely made them as bee, and in dissection also you must have seen the lungs, they resemble a bee shape somewhat. So remember, two drugs, bleomycin and busulfan. Both these cytotoxic drugs cause pulmonary fibrosis. Since they resemble the lungs, they cause pulmonary fibrosis. Now see this, the heart in the mediastinum, it purposely resembles like a D. So remember, the two drugs doxorubicin and daunorubicin, both are the cytotoxic drugs, and they cause what? Cardiotoxicity. One other drug, trastuzumab, you can see it's a monoclonal antibody. I've also made a T in the heart, so it also causes cardiotoxicity. And in the end, you can see I've made a bladder. So a bladder is like this. This is the cyclic structure we have studied in chemistry. A cyclic structure looks like this, and this is a Y. So remember, cyclophosphamide causes what? It affects the bladder. So it causes hemorrhagic cystitis. And since it causes hemorrhagic cystitis, it is always administered with a drug known as Mesna.